Numerous poets and authors have attempted to describe the experience of having a panic attack, which is so overwhelming that many individuals mistake it for having a heart attack, stroke, or another serious medical emergency. Although panic attacks don't injure a person physically over the long term, the fear of another attack might limit a person's everyday activities and lead to additional panic attacks. According to statistics, over 1/3 of us will go through at least one panic episode in our lifetimes. Hello, and welcome back to Know What. In this video, I'll walk you through the causes, symptoms, and treatment of panic attacks. No one wants to go through another panic attack, whether it's their first, their 100th, or seeing one happen to someone else. Even learning about them can be uncomfortable, but it's vital since understanding them is the first step to preventing them. The amygdala, the part of the brain responsible for processing fear, initiates the body's natural physiological response to the impression of danger. A panic attack is an overreaction to this response. The sympathetic nervous system is stimulated when the amygdala senses a threat, which leads to the production of adrenaline and an increase in heart rate and breathing to get more blood and oxygen to the muscles in the arms and legs. During a panic attack, this also delivers oxygen to the brain, making it more aware and receptive. Then, the amygdala relinquishes control, and the prefrontal cortex activates the parasympathetic nervous system. Acetylcholine, a hormone, is released in response to this, slowing the heart rate and gradually ending the panic attack. When someone experiences a brief, severe period of worry or uneasiness that something bad is going to happen or that there's some kind of threat or danger, they are experiencing a genuine panic attack. These emotions are frequently so strong that they're accompanied by physical symptoms like dizziness, shortness of breath, or heart palpitations. We aren't always sure why a panic attack occurs, but sometimes environmental signals that bring up painful memories from the past might cause one. In a panic attack, the body's perception of danger is enough to cause the response we would have to an actual threat. Some of these symptoms may linger for hours, although the majority peak during the first 10 to 20 minutes. Patients experiencing a panic attack can mistake it for a heart attack or another serious ailment. Since panic attacks can occur anywhere, even in places where there are no real hazards, they are unpredictable, which adds to concern about when the next attack will occur. The Diagnostic and Statistical Manual for Mental Disorders, 5th edition, states that for a condition to be classified as a panic attack, there must be a sudden occurrence of 4 of the 13 symptoms listed below: racing heart or rapid heart rate, chest discomfort or pain perspiring, quivering, breathlessness, dizziness, lightheadedness, shivers, numbness, feelings of choking, feelings of being separated from oneself, worries of losing control, and fears of dying. The fact that these are bodily symptoms and others are particular thoughts or ideas should also be noted. Depressive disorders, post-traumatic stress disorder, and substance abuse disorders are a few of the mental illnesses that can cause panic attacks. Additionally, anxiety disorders like PTSD, social anxiety disorder, OCD, and generalized anxiety disorder can include panic episodes. The two main therapies for panic disorder are antidepressant medication and cognitive behavioral therapy, or CBT. Both have about a 40% response rate, though someone who responds to one may not respond to the other. Recurring panic attacks, frequent worry about new attacks, and behavioral changes to avoid panic attacks can lead to a diagnosis of a panic disorder. Antidepressant drugs do have certain negative effects, and 50% of people who quit taking them relapse. CBT, on the other hand, has a 20% relapse rate and is more durable. The aim of cognitive behavioral therapy for panic disorder is to assist people in learning and using practical methods to exert physical and subsequently mental control over the feelings and ideas connected to a panic attack. The first step in cognitive behavioral therapy is a description of the psychological origins of a panic attack, which is followed by muscle and breath control exercises. The second step is cognitive restructuring, which is recognizing and altering the thoughts that are typical of attacks, such as believing you'll stop breathing, have a heart attack, or die, and replacing them with more correct thoughts. The objective of this stage of treatment is to alter the belief through experience. This stage involves exposure to the psychological sensations and conditions that often cause a panic attack. Even after CBT, adopting these actions during an attack is difficult, but with experience, these techniques can help prevent and de-escalate attacks, thereby lowering the gripping panic has over a person's life. That's it for today. Hope you enjoyed it. If you liked the video, please consider subscribing and sharing so we can keep bringing you more content like this. Also, let us know your thoughts in the comments below. See you next time.